virus. Measles is causing rubella, and it is mostly in children of 1 to 5 years of age, and it is one of the most contagious respiratory infections. See, it's a route of transmission is respiratory tract, but it has presentation over the skin. So it is systemic manifestation, but the route of infection is respiratory tract. Humans are the only natural host, and it can affect every person in a given population by adolescence. And in the absence of immunization program, infection is the only method for gaining the immunity. It usually produces epidemic usually in a late winter or the early spring, and the mode of transmission is large respiratory droplets, either airborne or direct contact, and the most infections usually occurring in the early stage before the rashes appear. So you cannot recognize that patient is having measles infection because it does not have any physical presentation, does not have any signs or symptoms. And during that period, early incubation period, patient is infectious, the child is infectious, and he is able to transmit the infection to the other children. So one child in the family can get the infection, then there are chances that other childs also get the infection. What is pathogenesis? The route of infection is respiratory tract or through the conjunctiva or the direct contact. They multiplies locally, then followed by lymph node replication. Then there will be a primary viremia. Through the viremia, they reaches to the reticuloendothelial cell system, and again they replicate, and then they again appear into the blood, and that is secondary viremia, and that is the heralding point for development of clinical feature. Incubation period is 1 to 2 weeks. And in 2 to 3 days, the patient will have a prodromal fever, running nose, cough, and conjunctivitis, and that is followed by typical manifestations of measles. Which are they? The coplic spots. This is typical spots which are slightly raised bluish white dots, which is around 2 to 3 millimeter in diameter, are seen on inside of the cheek shortly before the rashes on the skin appear. And these coplic spots, they persist for 1 to 3 days. After these coplic spots, there is a characteristic maculopapular rashes which is extending from face to extremities, which is involving palms and soles, and this is associated with the T cell attacking the virally infected endothelial cells in the small blood vessels. So this is pathogenesis of typical rashes of the measles, because the T cell attacks the virally infected endothelial cells, and there is a signs of inflammation, and there is a typical maculopapular rashes. The rashes last for 3 to 7 days and may be followed by brownish discoloration and finally skin exfoliation. Again, measles is different from the chickenpox and the smallpox, that it does not undergo other complicated stages like the papule, pustule, vesicles. There is no such presentations will be seen, only maculopapular rashes, which is followed by brownish discoloration and then skin exfoliation. And usually patients recover without any serious event, and patient will develop immunity against the virus. So you can see the rashes on the body of this child. It is all over the body, and it is typical maculopapular red color rashes. The virus means usually produce respiratory symptoms for 2 to 3 days. Then it is followed by coplic spots, which persist for 1 to 3 days and disappear after the onset of the rashes on the body. And these rashes appear for 3 to 7 days, and ultimately it disappears by skin exfoliation. Once the infection occurs, it provides the lifelong immunity. It is neutralizing antibody, and it protects the human being whole throughout the life. So this is the typical course of the disease, that the first respiratory infections occur, then virus grows in the lymph tissue, then it is an incubation period during which it goes to the lymph nodes, and then primary viremia, then secondary viremia, and ultimately it goes to the systemic presentation and appearance of coplic spots and the rashes. Complications of measles are important to understand. Usually it causes respiratory complications, otitis media, and bacterial pneumonia, that is secondary infections which are common. Then there will be giant cell pneumonia in patient with impaired cell-mediated immunity. It is very rare, but if the patient is immunocompromised and if he gets the infection, the child gets the infection with the measles, then there will be giant cell pneumonia. It is known as giant cell pneumonia because again the virus has tendency to form a giant cell, that is multinucleated giant cells. Neurological complication, it may lead to the post-infectious encephalitis, that is few days after the rashes develop. And another important point is this, you have to remember SSPE, which is the important complications of measles, and that is subacute sclerosing panencephalitis, which is occurring 1:1 lakh patient, but if it is occur, it is very fatal. Other complications, protracted diarrhea, suppression of delayed immunity. This is very important point, that measles lead to depression of antibody, delayed hypersensitivity, and is depressed, and so the if patient has tuberculosis, the Montauk stress is negative. So it causes suppression of immunity. So there are some viral infections also which lead to the suppression of immunity, and that can be a major factor for development of secondary bacterial infection. So worsening of tuberculosis, it also causes premature labor or spontaneous abortion if it is occurring in the pregnant woman, and can lead to thrombocytopenia purpura or the bleeding site. These are all immunological reactions. A diagnosis, usually the measles is so typical clinically that it does not require laboratory diagnosis. The clinical case is self-diagnostic, but still if you require, you can take nasal secretions or nasopharyngeal aspirate, and you can go for blood or urine specimen, and you can examine the virus under immunofluorescence technique. You can go for RNA detection, or you can isolate the virus in cell lines, and the growth is detected by multinucleated giant cell containing both intranuclear and intracytoplasmic and inclusion bodies. This we have discussed in general properties, that inclusion bodies are either intracytoplasmic or intranuclear, that is depending on the type of the virus. Usually the DNA virus produces inclusion bodies in the nucleus, and RNA viruses produce inclusion bodies in the cytoplasm. There are exceptions. Pox virus and measles virus is having inclusion bodies both in the cytoplasm and in the nucleus. So this is important point for a point for diagnosis of measles. Serological say diagnosis, again say you should have IgM detection, means antigen detection in early phase, IgM detection for recent infection, and if you have IgG detection kit, then you have to go for paired sera examination and four-fold rise in the antibody type. Prophylaxis. The measles, usually this is also having a live attenuated vaccine, and it is given to children in universal immunization schedule, and it is protective for lifelong. Single dose is sufficient, but sometimes it requires passive immunizations also, and that is because it causes the suppression of immunity. So for immunocompromised patient, it is given intramuscular injection within 6 days of exposure, and it prevents the severe manifestations or the complications of measles in 80% of cases, that is by measles antibody. And the active vaccine is live attenuated vaccine. It is given by subcutaneous injection. It is given at 9 months of age, and single dose is sufficient. It provides lifelong immunity, and it is available either in a monovalent form or again along with the MMR, that is measles, mumps, and rubella.